So we actually had the first ever international meeting to discuss the use of liquid biopsies in lymphoid tumors. There has been work that's been going on within solid tumors for quite some time, but I think the field is a little younger when we use it for lymphoid tumors. And that meeting brought together over 100 people from multiple different disciplines. And the reason why we're so excited about this is for two major reasons. First, you can actually measure DNA that's from the tumor in the blood itself. And when you do that, it actually correlates with the amount of tumor that you actually find in the person, such that higher amounts of tumor DNA in the blood means higher amounts of overall tumor. And so it is a quantitative measure. And by doing this, we're able to actually detect tumor down to a much lower level than we could ever do using conventional scans. So we can now detect tumor in the blood. Now this is circulating DNA, not cells, down to as low as 1 in 1,000 to 1 in 10,000 cellular equivalents, meaning that patients who have absolutely normal CT scans, if their tumor is not cured, we can often see it. And so it allows us to follow the tumor during therapy, and we now know that depending upon the kinetics of the fall of the tumor, that is prognostic in the most common type of lymphoma called large cell lymphoma. And we can also measure it after patients finish chemotherapy, during which time we would conventionally use CT scans, and a study we did, in fact, showed that we could pick it up months before the CT scan showed anything. But I think one of the most exciting parts of it is that we can actually measure mutations within the tumor, and we can identify what's called cell of origin. These are both critical when we start to think about personalized medicine, because we can now use targeted therapy and we can select patients for studies. And when patients are on targeted therapy, we can actually detect mutations that are associated with resistance to that therapy before the tumor mass becomes seen on CT scan. So it's a very exciting area, but being new and young, we need to have standardization and harmonization of the various tests.